All right. Okay, good morning and greetings on behalf of Delaware State University. I'm excited that you all are here. I see my cousin who's a farmer out there in the crowd. Mental health is extremely important, okay? We oftentimes find ourselves talking about our physical health. We do a lot of talking about physical health, but we neglect to talk about the importance of mental health. Now, in the farming world, farmers have a lot of stress that they undergo. There's a lot of uncertainties that can create a bunch of anxiety, depression from thinking about the weather. Just think about the weather, okay? I always say the meteorologist is the only one that I know that can keep their job and be wrong, okay? To often thinking about how crops, the influctuation of the cost of crops. All of that is stress, okay? Sometimes we have positive stress and sometimes we have negative stress. But when you're thinking about how you're going to take care of your families, especially for a lot of small businesses, that can become negative stress. So we have a panel here today. We have Ms. Kim Graham and Dr. House. I want to give you a bio and read their bios to you all so that you know their expertise. And just so that you know, by training, I'm here as the dean now, but by training, I'm a clinical psychologist. I'm also part of the Trauma Academy here at Delaware State University, as well as the dean. Kim Graham serves as the director of the Delaware State University's Trauma Academy. She is responsible for the development of courses and programs to equip practitioners and students to be responsive to trauma and the nuanced needs of specific communities. Two tracks of notes are African-centered healing and responding to trauma of domestic violence. Ms. Graham brings 20 years of experience working with schools to provide a continuum of art-based education from pre-K through high school, employing strategies for youth development based on strength-based, culturally competent, trauma-informed tenets. Serving at Promise Youth at varying points on the prevention intervention continuum through the arts has been a key component of the work. Ms. Graham holds a Master's of Arts in Clinical Psychology from Westchester University with a concentration in psychodrama. In addition to the 20 years spent engaging youth, adults, educators, children, and their families, Ms. Graham has over 5 years of experience providing therapeutic support in the drug and alcohol field. These opportunities have provided tangible knowledge of both the impact of trauma on children and their families, as well as the realities of vicarious trauma and historical trauma. Kim serves as a co-chair of the Trauma Matters Delaware's community-based healing subcommittee and a member of the higher education subcommittee. Let's give a round of applause for Ms. Kim Graham. The next expert we have is Dr. House. Dr. House is the Engagement and Equity Officer for the 988 and Behavioral Health Crisis Coordinating Office at the Substance Abuse and Mental Health Services Administration within the Department of Health and Human Services. SAMHSA and the 988 and the BHCCO provide federal leadership on behavioral crisis services at the federal, state, local, territory, and tribal levels. The 988 and the BHCCO office is responsible for strengthening and expanding the 988 Suicide and Crisis Lifeline, and more broadly, for transforming America's behavioral health crisis system. Dr. House has nearly 20 years of federal service and 30 years of experience and dedicated work in the behavioral health and human services field. In her current role, she serves as a lead and senior advisor for strategic engagement and equity with a focus on leading the office's strategic crisis engagement efforts with diverse partners, including those with lived experiences and consistent with SAMHSA equity goals. Prior to this, she served as a regional administrator at the Administration for Community Living at HHS, whose mission is to maximize the independence, well-being, and health of older adults, people with disabilities across the lifespan, and their families and caregivers. Now, in this role, Dr. House provided oversight, guidance, and technical assistance to 5 regions, 3 states, in the District of Columbia that received Older Americans Act grants to support the older adult services and other ACL funding. Her federal experience also includes positions as a senior management and program analyst at ACL and team lead and senior analyst at a previous justice federal agency, pretrial services agency. In both positions, she led national evaluations, performance management, strategic planning, engagement, and contract management. She also completed federal details working on priority initiatives at the Center for Disease Control and Prevention, the Office of Management and Budget, and the Assistant Secretary for Planning and Evaluation. Dr. House earned her PhD in social work from Howard University with a focus on mental health and health disparities, a master's in social work from the University of Pennsylvania, and a bachelor's of art from the American University. She was a National Institute on Mental Health predoctoral fellow, a National Institute on Drug Abuse postdoctoral fellow, and research investigator at the Washington University in St. Louis in the Brown School of Social Work and Public Health in the Comorbidity and Addiction Center. Boy, you did a lot. You did a lot. Okay, so at this time, how this is going to work, I'm going to have each one of the panelists to present on the topic, and then subsequent to them presenting on the topic, we're also going to give you all an opportunity to ask any questions that you may have, okay? So without further ado, who do we want to start with first? Okay, we're going to start with Ms. Grant.
Good morning, everyone. I would like to just commend the organizers of this awesome event for being sensitive to the needs of the community and responding in such an overwhelmingly positive way to bring the voices of those who are not heard to light, to address the importance of the farming community and the Black farmers in particular. And I am, as Dr. Scott Jones said, I'm from a arts background as well as mental health, so I like to mix those things together when I have an opportunity to talk to people. So if it feels a little different, I hope that's okay. Grandma's hands went to church on Sunday morning. Grandma's hands used to ache sometime and swell. Grandma's hands soothed a local unwed mother. She said, "Baby, Grandma, understand that you really do love that man. Put it all in Jesus' hands, Grandma's hands." Most of us can think of how much our grandmas meant to us. And we can think of all the things that they did with those hands. Sometimes they straightened us out. Sometimes they stirred the pot of those chicken and dumplings. And sometimes they just soothed your face. There's a man, his name is Resma Minicum, and he wrote a book called My Grandmother's Hands. And in his book, he tells a story about having an interaction with his grandma, and he noticed that even though she was a petite woman, her hands were rough and burly. And he said, "Grandma, why do your hands look like that?" And she said to him, "It comes from picking cotton." And he said, "Ma'am," she said, "see, when you stick your hands down in that cotton, the thorns scratch your hands up. But you can't stop the work. You got to keep sticking your hands down in there. And eventually they scar over. And then you don't feel the pain anymore." Well, he used this to talk about how we carry trauma and pain in our bodies. And he used it to talk about how if we don't learn how to manage that pain, all we do is keep covering it up until it scars over and we almost become numb. I know that I am only 2 generations removed from farming. My grandmother and my grandfather, along with, migrated from North Carolina, from a little town called Newton Grove near Fayetteville and Dunn. They were tobacco farmers. And they moved here and created a life that we keep on living. But they brought with them our historical pain and our historical strengths. And when I think of our farming community, we have so much in common because you are carrying on a legacy that is important. They say if you don't work, you can't eat. Well, if you don't farm, we can't eat. And so we want to honor that, but we also want to be able to create a space that can speak to what keeps you healthy enough to do the work that you do. The Trauma Academy here at Delaware State University was founded because a group of individuals from the community raised their voices, much like is happening here with the Black farmers of Delaware. You have raised your voice to raise a concern. And what we considered was how important it is to understand trauma and pain from the eyes and the experience of the people who are holding that pain. It's not time. I have to come to you with cultural humility, because even though I'm only a few generations removed, I don't know what it's like to get up early in the morning to do the work that you do. I don't know what it's like to work 7 days a week. Well, sometimes I do. But we have to open our ears to listen to what you need and what we can do to meet those needs. And both of those statements are really embedded in an African-centered practice. One of the things that our certificate started with initially was understanding that African Americans are more likely to experience mental health stress and trauma than other races. But we are least likely to reach out to get the support that we need. And when you take that to the level of African American farmers, the numbers multiply. The rates of suicide, depression, anxiety are very high. And similarly, the feeling that there's not someone that's going to understand your lifestyle, that's going to understand the realities of what you face when you come to talk about your problems, can create a barrier. And so one of the things that we have done on this campus is we initiated a program called the Mental Health Ambassadors. And the mental health ambassadors are trained. They are college-age students that are trained to be able to connect with other college-age students to have real conversations about wellness. And as I began to review information around mental health and farming, I discovered that there are several states, such as North Carolina, that use a very similar approach. They have a program called Farmer to Farmer, where they actually pair seasoned farmers with those that are beginning in the trade so that they can be able to talk with them and share and make connections. They use circles, which is another aspect that we train our students in, to be able to sit down around the table and break bread but have meaningful conversations that can then open the door to move to talk to deeper areas. Another strategy that we use here with our ambassadors is mental health first aid. And that is training individuals to be able to recognize the early signs of mental health needs. And they actually have a specific certificate that deals with how do you deliver those services to rural communities. So those are 3 examples of strategies that we currently use on our campus that could be translated with communication and with a shared learning practice to our farming community as a strategy to begin or to deepen the work of addressing mental health issues. One of the things that is important to understand is the pain and the trauma that we're talking about. When it's unaddressed, it can take up to 20 years off of your life. 20 years off of your life. Some of the diseases that we commonly think of as only being diet related, diabetes, high blood pressure, we know that they are stress related diseases. And we know that they are very prevalent in the African American community. Because when you stay stressed, the chemicals in your body that manage that stress never get a chance to go back down to zero. So you stay on edge all of the time. And your body cannot handle that over and over and over again. And so we know that if you're stressed, how does that affect every other aspect of your responsibilities during the day? How does that affect how you interact with your family? How does it affect how you deal with those that you employ? Because we pass our pain and our trauma from person to person to person to person. It's worse than COVID. But we also can pass our joy. We also can pass our resilience. We also can put our arm around someone and say, listen, I've been here. I know what this feels like. And I want you to be able to survive, because it's all about connection. And my understanding is that it's very easy for people in the farming community, particularly in the African American farming community, to deal with isolation. And there is an African principle that I am human only when I'm in relation with others. That's what makes me human, being connected. I am because we are. And so if we aren't doing well, then ultimately I'm not doing well. But when I'm doing well, then we can all do well. And so the Trauma Academy seeks to train both those that are already out in the field to be more aware of an African-centered lens. And you may say, well, what in the world is this African-centered lens? We have been educated predominantly based on a Eurocentric approach. If you're talking about psychology, almost everybody's heard of Freud and heard of sitting on the couch, or people call it going to see the shrink. And there's nothing wrong with that. All of the principles are strong and they're valid, but do they take into consideration the cultural differences that exist in communities? African Americans tend by nature to be very communal. And we often make decisions that take in consideration our family and our community. As a Western society, we've moved to a very individualistic, I do what I want to do, whether my family agrees with it or not. If you are from a communal background and you're talking to a therapist, you want your therapist to understand that your family is important to the decisions that you make, and not negate that as you being unable to stick up for yourself. That's just as an example. Another difference is African Americans, we all got that something said, don't we? I heard a all the way over there. We got that. We have that something said, that sense of intuition. But Western society can often teach us that if I can't prove it, if I can't measure it, then it doesn't exist. And it can teach you to negate that uh-oh feeling. It can teach you to deny that what I'm sensing is in fact real. It might take a while before it manifests that other people can see it, but it's just like that seed in the ground. When you put that seed in the ground, you can't get to see that it's already started to drop its roots. You can't see that it's already making its way up to the surface, but you know it. And you got to trust that you know it. And so embracing an African-centered lens begins to explore both strategies that resonate with African Americans and other people of color, And it helps to understand worldview, and it helps to understand reality. One of the things that is also very important is that concept of generational trauma. There's trauma that comes to us through our lived experience growing up, but there's also trauma that we carry from 400, 500, 600 years ago. And at one point in time, scientifically, that was kind of thrown to the side. But even science bears witness that we carry it within us. And if we don't heal it, we pass it on to our next generation. And when we're talking about passing on generational wealth, it's time for us to make sure that that generational wealth includes generational health. And that's what we're here to talk about today, creating generational health. All right, let's give Ms. Graham a round of applause. Excellent. Now we're going to hear from Dr. House.
All right, thank you. Good morning, everyone. How are you? Okay, so that was powerful. Thank you for that. Thank you, thank you. So I have a PowerPoint, but as I heard your comments and I was just uplifted and inspired, I may deviate a bit from my PowerPoint, but I want to just say good morning to all of you. It's certainly a pleasure to be here today. This is a powerful event. I met some farmers on the elevator who welcomed me right here at this table here and told me that yesterday was fantastic. And so I know that today will be as exceptional. I'm really happy to join you today. This is a powerful conference, and it's focusing on something, a topic, and a community that are not only brilliant, but integral to the very fabric of our communities and the nation. And I want to thank Delaware State for inviting me. I also want to thank Professor Leandra Casson-Marshall for inviting me. We met actually at the USDA Farmer Stress Suicide Summit. And then we ran into each other again at the HBCU Conference Week. And she told me about this work and the conference, and I got excited. I mean, she's got energy and dynamism. And I said, I'm going to go back and talk to my agency, to SAMHSA, and to my office about supporting the event. And so I'm glad that we could be here and support the event. I come to this space, first of all, very grateful, very grateful. I'm the daughter, I'm the granddaughter, I'm the great-granddaughter of farmers, right? So I come to this space with that humility and that understanding. I was born and raised, along with my three brothers, older brothers in Washington, D.C., but our parents are from Oklahoma. We are Midwesterners, Oklahoma and Texas. And so they're from small towns, from Guthrie, Oklahoma, and Langston, Oklahoma. I don't know if you guys have heard of Langston. It's the home of Langston University, a proud HBCU, like CU, just like Delaware State. And I just give honor to my grandparents, to my father, to all of those relatives who were farmers, because I realized that it is their shoulders, their tireless work, their sacrifices that are the reason that I'm here, If it weren't for them, I wouldn't be here today. So I'm very thankful and grateful. So I bring that experience here. I also was thinking as you were talking, and I bring some other experiences that I didn't share in my prepared remarks that I want to share with you because I think they're important and they align with what you shared. I'm a professor at Howard University. I finished my PhD at Howard University in the School of Social Work. And our school is grounded in what we call the Black perspective, the strengths perspective. And so I think that as we were trained, and as I teach my students there, we want to make sure that our students are coming from a strengths-based perspective in whatever they do, if it's mental health, if it's child welfare, but they're coming from a strengths perspective, and they're coming from an affirming perspective and a culturally responsive perspective. I also come to this space as a member, a proud member for 30 years of the National Association of Black Social Workers and a graduate of their African-Centered Academy. And we were trained in the African-Centered social work model in terms of doing mental health and other types of social work. And so I bring that into this space as well. And I also bring my experience with an organization called the Black Family Summit into this space. And that's an organization, a national organization of about 30 plus Black professional organizations in this country that care about the Black family and the Black community and come together to do work around the Black family and the Black community, and that includes mental health. So today I want to take a little time to share with you what my office does at SAMHSA. So I am at the Substance Abuse Mental Health Services Administration, and we are within the U.S. Department of Health and Human Services. And my office is the 988 and Behavioral Health Crisis Coordinating Office. We're new. We're the new kids on the block at HHS. We've been around since July of 2022, so we just celebrated our 1-year anniversary. We're a small office. There are about 30 of us, but we've got a mighty mission that we are committed to do. And what I want to talk today about is a valuable resource that we have the honor of leading and monitoring, a crisis behavioral health line, the 988 Suicide and Crisis Lifeline, which provides a valuable resource to every American in this country. We like to say in my office that the Lifeline provides someone to talk to, someone to respond to, and a safe place for help. Next slide, please. Am I supposed to move this? Is there anyone who? There's a clicker? Oh, here we go. I didn't see it. So let's see. There we go. Hey, that was easy. So who we are, SAMHSA. We're the agency that leads public health efforts to advance the behavioral health of the nation and to improve the lives of individuals living with mental and substance use disorders and their families. And our vision is simple. We envision that people affected by, at risk for mental health and substance use conditions receive care, thrive, and achieve well-being. I want to share a little bit about the 988 line. I hope, has anyone heard of 988, these 3 digits? Raise your hand if you've heard of 988. You've heard of 988? Good, good. Before you leave here, I'm going to have you make a commitment, right, to tell at least one other person about 988. But let me just share a little bit about what it is. So I'd like to just share a little background on 988, how we emerged, and our timeline, the need that really was the impetus for our being developed, our strategic goals and vision, how it works, how the 988 Lifeline works, because anyone can call 988. Also want to share our vision regarding behavioral health equity, some resources that we have, our partner toolkit, and also just talk a little bit about first responders, 988, how that works, because a lot of people, when they hear about 911 or 988, they think 911, right? And in our community and other communities that have been historically underserved and marginalized when it comes to behavioral health, that's a concern. They're concerned, if I call 988, what's going to happen, right? What's going to happen? So let me just move forward and just talk to you a little bit about our background and timeline. 988 is really not new, so I'm not sure if you all heard about the previous National Suicide Prevention Lifeline, but 988 is really a rebranding of that. That was started in 2005, and SAMHSA, my agency, was the federal entity that was responsible for the National Suicide Prevention Lifeline, implementing it and monitoring it. A lot of things happened in between 2005 and 2020, but as a result of a lot of advocacy, the FCC designated 988 as a new 3-digit number for suicide prevention and mental health crisis. The thinking was that this would be easy for people to remember. Just like you remember 911, 988 would be an easy number to remember if you were having some concerns, some mental health concerns or crisis, or you had a family member or someone else who was experiencing that. In 2020, Congress actually passed the National Hotline Designation Act, which basically signed 988 and into legislation, into law. And then our office was actually operationalized. It was launched in July of 2022. So the need, what prompted this? Well, in 2021, there's some stats that are staggering that I want to share with you that I'm not sure if you know, but I'm sure you can probably imagine given all of the crises that we've experienced nationally in this country. But in 2021, nearly 900,000 youth ages 12 to 17 and 1.7 million adults attempted suicide. There was approximately 1 death by suicide every 11 minutes. And suicide was actually, in 2021, the leading cause of death for people ages 10 to 14 and 15 to 24 years. Suicide rates also increased significantly among non-Hispanic Black and American Indian and Alaska Native people. And then more than 107,000 people died from drug overdoses. So what that told us and what that tells us, I think, is that too many people across this country are experiencing suicidal, mental health, and or substance use crises without the support and the care that they need. So when we look at the farming community, there's been a lot of research done in that population and community, and stress is high. Stress is high. I mean, farming, what we know is that farming is a stressful occupation, and it's associated with increased anxiety and depression, long hours, just strenuous work days and routines, some isolation, particularly the research shows that Black farmers at times experience some isolation. The numbers have decreased nationally of Black farmers to, I think they're 1.4% of the farmers nationally are supposedly Black farmers. So there's some social isolation at times that's experienced. And then farmers' jobs are also compounded by other things: economic uncertainty, vulnerability to weather, as was mentioned earlier, and isolation, as I mentioned. I don't know if you know this, but based on CDC data, the suicide rate among farmers is 3.5 times higher than the general population. And rural populations have a significantly higher suicide rate than urban areas. And 45% of farmers and ranchers' suicides in the last 2 decades or so were committed by people ages 65 and older. So it just really hits home the risk for the young, the risk for the old, the elders, our elders, and everybody in between. And it suggests that mental health challenges are critical. They've become very critical and it's important that we address them so that farmers can successfully navigate their lives and other stressors that are common on a day-to-day basis. So what do we know about the unique challenges for black farmers? I think that's important because that's what our conference is about. There's not a lot of research, like empirical research on the experiences of black farmers, data on but there's anecdotal information and research and studies. And what we know is that we need more research, right, to truly understand the experiences and the factors that are facing black farmers. But we also know that black farmers face some of the broader issues that black people face and have faced historically. Issues like structural and systemic inequities, negative interactions with banking and lending, and government institutions, stigma, again, social isolation, and what some have coined, and actually you talked about it earlier, race-based trauma. And what we also know is that building social support systems and networks is critical to circumventing these inequities and these issues. So, what's my agency's role in terms of addressing these issues? It's twofold. My office's role is twofold in my agency. We serve as the lead federal organization for the 988 Suicide and Crisis Lifeline. And then we serve as the lead federal organization for behavioral health crisis services transformation across the country. We have two overarching goals and strategic objectives that are aligned with each of our broad goals. The first goal is to strengthen and expand the 988 Suicide and Crisis Lifeline nationally. And then the second is to transform America's behavioral health crisis system. Now, we're excited. We're excited. Let's see, I'm not able to move forward. We're excited because of this important step, this transition to 988 as a new way to get help. And significant investments have been made in 988 Lifeline capacity that I'll mention lately at the federal, state, and local levels. And the goal has been to help ensure that the Lifeline can respond to many more people in crisis. But we also know that transformation of this type and this scale will take time, and so we are building it out. We are scaling it up. What we also know is that we want everyone to know there's hope, whether you're experiencing thoughts of suicide, substance use, mental health crisis, or any other kind of emotional distress. There's compassionate support available 24/7. And I've heard stories as I've traveled and gone to conferences and meetings and done exhibition tables of people who have called 988, and they've attested to the fact that they reach counselors who are localized in their areas, who provide them with someone to talk to. Somewhere to go, a safe place to go, resources. And although it's called 988 Suicide and Crisis Lifeline, we recognize that crisis means different things to different people. You don't have to be in a suicidal crisis to call. So we want to make sure that people know that you don't have to be in the suicide on the suicide trajectory to call. Whether you're experiencing distress, or helping a loved one who's in distress, or concerned about drug or alcohol use, you can call, text, or chat 988 24/7. So, trying to see where I am. In the longer term, our vision for 988 is to build a robust crisis care response system across the country. that links 988 Lifeline callers to community-based providers who can deliver a full range of crisis care services if needed, like mobile crisis teams or stabilization centers, in addition to connecting callers to tools and resources that will prevent future crisis situations. With rising levels of mental health issues in the country, it's crucial that people have somewhere to turn when they're in crisis. So let me just briefly say how, or share with you how the 988 Lifeline works. So this is how it works. You call 988, and you're given 4 options once you call. If you press 1, you'll be connected with the Veterans Crisis Line. We have a push-button option that links you directly to the VCL, which is administered by the VA. If you press 2, you'll be connected with the Spanish sub-network. If you press 3, you'll be connected with the LGBTQI plus support for people under 25. And if you remain on the line, you will be connected to a local crisis center. And if a crisis center is unable to answer, you will be routed to a national backup center for help. You can also text, as I mentioned earlier, you can chat, and we also now have ASL services for the deaf and hard of hearing. So we have multiple ways for you to get through if you're in crisis. So as I mentioned, we started a year ago in July, a little over a year, and we have learned some things. We have some good data. We received more than 5 million calls, contacts, either calls, texts, or chats in our first year between July 2022 and July 2023. That's nearly 2 million more than the previous 12 months. The calls answered increased 46%, chats increased by 141%, and text increased by 1,135%. And during that same time frame, there was a significant improvement in how quickly contacts were answered, from 2 minutes and 30 seconds to 41 seconds. And actually, I think it's down now to closer to 30 seconds. And so I just want to briefly share the successes, some other successes. We've received significant investments of nearly $1 billion, our office, from the Biden-Harris administration, and it's helped to strengthen the Lifeline and our efforts across the country. As I mentioned, the answer rates, the national answer rates for calls, chats, texts have increased tremendously over the last year. We've enhanced our technology, and we've expanded the 988 Lifeline Partner Network to include tribal communities as part of SAMHSA grant making. And this $1 billion investment doesn't include funding for mobile crisis response, certified community behavioral health clinics, dedicated crisis care related funds within SAMHSA's Community Mental Health Services Block Grant, which are also critical parts of the crisis system, the crisis continuum. I'm sorry, I can't see. Okay. And so I just want to as I close up, just talk about the importance of having a resource like this and using it. We want you to use it. We want you to use it. Farmers, we want you to use it. It's one resource, but it's a national resource that can help. It can help. And so we're hoping that you use it. We're also hoping that you will reach out to us. I'm going to pull up the last slide with our information. If you have questions, if you need information, if you need additional promotional materials, please contact us. Please email us. And as I close, I just want to ask every person in the room to repeat something. To repeat something after me. If I'm struggling emotionally, or I know someone who's struggling emotionally, I'll mention 988. All right, thank you.